Well, as many of those case numbers rise, Ohio hospitals are struggling with proper staffing. This morning, our Amy Steigerwald is taking a closer look at where our local hospitals stand. And Amy, we know this is very important because we are seeing these struggles across the country.
Yeah, Tiffany, that's right. Right now, hundreds of National Guard members are deployed at area hospitals here in Ohio to assist with those staffing shortages and try and give the hospital staff a much needed some help. But there are no National Guard members, I should say, here in Northwest Ohio. But even though there are no active Guard members currently working here in Toledo hospitals, representatives with ProMedica say they've been experiencing staffing concerns since early this spring, with healthcare workers being fatigued from the past almost 2 years now. Adjustments have to be made continuously throughout the hospital to care for the influx of patients. ProMedica tells me they've hired nurses from external agencies to come in and fill those gaps. Now, as far as if Guard members could potentially come here, I'm told by both ProMedica and Mercy Health representatives that they have been in communication with the governor's office and provided their staffing numbers to his office.
At this stage, Northwest Ohio is not receiving a deployment, but the governor did make mention that he's watching the Northwest Ohio area. He's concerned, and if there is a need and availability, that future deployments would be considered.
Now, right now, Dr. Kaminsky tells me 1 out of every 5 patients that they admit at a ProMedica facility is admitted for COVID-19. Coming up at 5:30, I'll discuss how those National Guard members will assist hospitals across the state and when we could potentially get those members here. Reporting live in West Toledo this morning, Amy Steigerwald for WTOL 11.